Okay, so let's imagine this scenario. An animal, maybe your dog or cat, suddenly starts drinking like crazy, urinating constantly, but they also seem off, weak, unwell.
Yeah, that picture could be pointing towards something serious.
Yeah.
We're talking about diabetic ketoacidosis today, DKA for short.
Right, DKA. It's a major medical crisis, and it happens when there's a real lack or relative lack of insulin doing its job in the body.
And that lack of insulin, it sets off this whole cascade of problems. It's not just one thing going wrong.
Exactly. Our sources for this, detailed medical texts, they really lay out this chain reaction.
They do. You get this dangerously high blood sugar hyperglycemia.
Okay.
Then ketones start building up in the blood. That's ketonemia.
Ketones, those are byproducts of fat burning.
Precisely. And too many ketones make the blood acidic, metabolic acidosis.
Mm-hmm.
Plus, you've got severe dehydration happening, and the body's electrolytes, things like potassium and sodium, get completely out of whack.
Wow, okay, so quite a storm brewing internally. So for this deep dive, we're going to unpack all that using this solid medical information. We want to really get into what DKA is, why it happens.
What signs you should be looking out for?
Yeah, what to look for, and crucially, how it's treated. We're aiming to make this pretty complex medical challenge, well, a bit clearer for you.
Sounds good. So the basics first.
Let's do it. The core definition, like we said, it's a medical emergency. Insulin deficiency leading to that whole list. High sugar, ketones, acid dehydration, electrolyte problems.
Right. And the pathophysiology, this sort of how it happens, it starts with that insulin issue.
So insulin's like the key, unlocking cells. So sugar, glucose can get in for energy.
That's a great way to put it. Without enough working insulin, glucose stays stuck in the blood. Levels shoot up hyperglycemia.
But the body still needs fuel.
Exactly. So it panics, essentially, and switches to breaking down fat. That's lipolysis.
Okay, the fat breakdown.
Yeah.
And that produces the ketones we mentioned.
Yes. And normally, the body can use some ketones for energy.
Mm.
But in DKA, without enough insulin action, even the ketones can't be used properly.
Ah, so they just build up.
They build up, and that's ketogenesis running wild. And because they're acidic, they push the blood pH down. Metabolic acidosis.
So the body's backup plan actually causes another huge problem.
Pretty much. And then there's the fluid side of things.
Right, the dehydration. How does that fit in?
Well, all that extra sugar in the blood makes the blood really concentrated. The kidneys try to filter it out.
Mm-hmm.
And as the sugar spills into the urine, it drags a whole lot of water with it. It's called osmotic diuresis.
Like a sponge soaking up water?
Sort of, yeah. It pulls water out of the body,
Uh-huh.
leading to massive fluid loss. And with that water go vital electrolytes, potassium, sodium, chloride.
Leading to dehydration and those electrolyte imbalances. It's all connected.
Really is. And there's another layer too, stress hormones.
Oh, yeah, the texts mention those. Glucagon, cortisol.
Epinephrine, growth hormone. These can surge if there's something else going on, like an infection or maybe heart problems.
And they make the DKA worse.
They often do, unfortunately. They can counteract insulin, making the body even more resistant to whatever insulin is around.
Okay.
And they tend to boost fat breakdown and ketone production, and even tell the liver to make more glucose. So they just fuel the fire.
It becomes a vicious cycle then.
Exactly. A self-perpetuating problem.
So who actually gets DKA? Is it specific animals?
Well, the sources focus on dogs and cats primarily.
Okay. Any particular breeds?
In dogs, yeah, it seems miniature poodles and dachshunds pop up more often in the data.
Interesting. Why them, I wonder?
That's a great question. The texts don't really specify why. Could be genetic, metabolic, something we don't fully know yet. For cats, though, no specific breed link is mentioned.
Okay, so poodles and dachshunds and dogs, but more general in cats. What about age?
For dogs, the average age seems to be around 8.5 years old.
Middle-aged, sort of.
Yeah. For cats, the median age is a bit older, around 11 years, but it's a really wide range. They've seen it in kittens, 1-year-old all the way up to 19-year-old cats.
Wow, quite a spread in cats. And male versus female. Any difference?
Yes, and it's actually opposite in dogs and cats, which is interesting.
Oh,
Female dogs seem to be about 1.5 times more likely to get DKA than male dogs.
okay.
But in cats, it flips. Male cats are about twice as likely to get it as females.
Huh. Any idea why that difference exists? Hormones, maybe?
That would be a logical guess, maybe hormonal influences or metabolic differences between the sexes in each species. Again, the source doesn't detail the why, but it's a noticeable difference.
Definitely food for thought.
Yeah.
Okay, so if an animal is developing DKA, what are the signs? What should you, as an owner, be watching for?
Well, some early signs can be pretty classic diabetes signs,
Yeah.
just maybe more intense, like drinking a lot more water that's polydipsia
Right.
and urinating a lot more polyuria.
Okay. Increased drinking and peeing.
Yeah. Though, interestingly, sometimes they might actually stop drinking or drink less, which is called adipsia. That's also a worry.
So big changes in thirst, either way.
Exactly. And then just seeming off. Less active, maybe losing interest in playing or walks. Loss of appetite is common to anorexia, general weakness.
Those sound like signs that could mean lots of things, though. Are there more specific DKA red flags?
Yes, as it gets more serious. Vomiting is a big one.
Oh, wow.
Lethargy becomes much more pronounced, even progressing to depression.
Okay.
You might notice muscle wasting, weight loss. Even if they were eating okay before, their coat can look dull, unkempt.
Right.
Breathing might become rapid and shallow to tachypnea. Dehydration signs become clearer, like tacky gums, sunken eyes.
You can sort of see the dehydration.
Yeah, and they might feel really thin. In bad cases, their body temperature might drop hypothermia, sometimes dandruff. And a really characteristic sign, though not always present, is the smell.
The smell.
Yeah, a sweet, almost nail polish remover type smell on their breath. That's the ketones, specifically acetone.
Ugh, the ketone breath.
Okay, you might also see, though less commonly, a yellowish tinge to the skin or eyes that's icterus or jaundice. And sometimes the vet might feel an enlarged liver or thickened bowel loops.
That's quite a list. Really shows how systemic this condition is. So what actually triggers it? We know it's about insulin, but what's the root cause?
The absolute main underlying cause is insulin-dependent diabetes mellitus. The animal is diabetic.
Right. But lots of diabetics don't get DKA, so what pushes them into it?
That's the key question. Often it's a concurrent illness or stressor. Infections are huge culprits.
Like what kind of infections?
Urinary tract infections, skin infections, respiratory infections like pneumonia, infections in the prostate or uterus. Basically, anywhere the body is fighting something off.
And the infection stresses the body, messing up the insulin balance.
Exactly right. That stress response ramps up those counter-regulatory hormones we talked about, worsening insulin resistance.
Got it. What else besides infections?
Other diseases happening at the same time. Things like heart failure, pancreatitis, inflammation of the pancreas, kidney disease, even things like asthma or cancer.
Wow.
Certain hormone disorders like acromegaly, which involves excess growth hormone. Even just the hormonal cycle of being in heat for a female dog can sometimes be enough of a trigger.
So lots of potential triggers.
Definitely. And sadly, sometimes we just don't find a specific trigger. We call that idiopathic.
And what about managing the diabetes itself if someone isn't giving insulin correctly?
Oh, absolutely critical. Noncompliance, missing doses, giving the wrong dose, inconsistent timing, that's a major and often preventable risk factor for DKA.
Makes sense.
Also, significant stress events like surgery, boarding, major household changes can sometimes push a susceptible animal over the edge.
Okay.
And the texts also mention a history of using certain drugs like corticosteroids, steroids, or beta blockers can increase risk, probably because of how they affect glucose metabolism and insulin sensitivity.
So a complex web of causes and triggers. If a vet suspects DKA based on the signs, how do they confirm it? What else might look similar?
Good point. They need to rule out other serious conditions. The differentials mentioned include something called hyperosmolar non-ketotic syndrome, similar high sugar, but without the ketones and acidosis.
Okay.
Also, an acute hypoglycemic crisis, meaning low blood sugar, which can cause collapse but is the opposite problem. Kidney failure, or uremia, can cause similar signs, like lethargy and vomiting. And lactic acidosis, another type of metabolic acidosis from different causes.
So how do they pinpoint DKA specifically? Tests, I assume.
Absolutely.
Yeah.
Blood tests and urine tests are key.
What do they look for in the blood?
Okay, so typically you'll see a high white blood cell count, often with more mature neutrophils suggesting inflammation or infection. Blood glucose will be high, usually way over 250 milli-GDL.
Very high sugar.
Yep. Liver enzymes might be elevated. Cholesterol and other fats can be high. Kidney values like BUN and creatinine are often increased, largely due to the dehydration.
Right, the kidneys are struggling.
And electrolytes are usually messed up. Low chloride, low potassium, low sodium, low phosphorus are common findings.
The ones lost through urination.
Exactly. And a really important clue is the anion gap. It's a calculated value, and when it's high, it strongly suggests there are unmeasured anions like ketones accumulating in the blood, causing acidosis.
Okay, high anion gap equals likely acidosis from ketones. What about the urine?
The urine test, the urinalysis, is crucial. Finding both glucose and ketones in the urine is a hallmark of DKA.
Can't really miss that combination.
Pretty much nails the diagnosis when combined with the clinical signs and blood work. Urine concentration can vary, and you might see signs of infection or inflammation in the sediment.
Any other lab tests?
Yeah, they'll often check venous blood gas or total CO2 levels to confirm the metabolic acidosis. Low TCO2 means acidosis. Blood osmolarity might be checked and will usually be high, over 330 myosyms kilogramma,
Yeah.
due to the high sugar and dehydration. And they might run cultures on urine or blood if infection is suspected.
What about procedures? Anything like imaging?
Imaging isn't usually primary for diagnosis, but an electrocardiogram, an ECG, can be useful.
Why an ECG?
It helps assess the potassium situation indirectly. Changes in the heart's electrical activity, like a prolonged QT interval, can suggest low potassium, while tall, spiky T waves can suggest high potassium. It gives a quick clue while waiting for lab results.
Ah, clever, like a window into the electrolytes.
Sort of, yeah. And pathologically, if you were to look at the pancreas tissue itself, you'd see atrophy, basically wasting away of the insulin-producing cells.
Okay, so diagnosis confirmed, it's DKA, we know it's serious. What's the treatment plan?
It really depends on how sick the animal is when they present.
Okay.
If they're relatively stable alert, maybe only mildly dehydrated, still willing to maybe eat a little sometimes, they might be managed as an outpatient, or at least with less intensive initial care.
Like home care.
Possibly, with very careful instructions. Subcutaneous insulin, maybe adjusting the type or dose, ensuring food and water intake, and extremely close monitoring and follow-up with the vet. But that's the less common scenario for true DKA.
Right. So what about the really sick ones? The ones that are collapsed, vomiting, very dehydrated?
For those thick DKA patients, it's an absolute emergency requiring intensive inpatient hospital care, no question.
Okay. Intensive care. What are the main goals?
There are three main pillars, really. First, fix the dehydration and electrolyte chaos. Second, stop the ketone production and reverse the acidosis. And third, get the body using glucose properly again with insulin.
Makes sense. How do they tackle goal number 1, fluids and electrolytes?
Intravenous fluids are usually step one, often starting with 0.9% saline, a balanced crystalloid. This helps rehydrate, supports blood pressure and circulation, and actually helps slowly lower blood glucose just by dilution and improve kidney function.
How much fluid?
It's carefully calculated. They figure out the deficit based on how dehydrated the animal is, add in daily maintenance needs, and account for ongoing losses. This total volume is usually replaced over 24 to 48 hours.
And electrolytes get added to the fluids. You mentioned potassium earlier.
Yes, potassium supplementation in the IV fluids is almost always needed. Even if the initial blood test looks okay, the total body potassium is low, and fluids and insulin will drive potassium into the cells, making the blood level drop fast.
So it's preventative, almost.
It is. They have to be careful, though. Ideally, check potassium before starting insulin. If it's critically low, they might need to give potassium first for a bit.
Right. And you mentioned magnesium sometimes, too.
Yeah, if the potassium stays stubbornly low despite giving plenty, low magnesium might be preventing it from correcting, so they might supplement magnesium too. It's all about careful monitoring.
Constant monitoring seems key. Okay, goal 2 and 3, stopping ketones, fixing acidosis, using glucose. That sounds like insulin's job.
Exactly. Insulin is essential. It stops the fat breakdown, tells the liver to stop making extra sugar, and helps the body's cells finally take up the glucose that's flooding the bloodstream.
What kind of insulin do they use?
Initially, it's usually regular, short-acting insulin. This gives the most control.
How is it given?
For really sick animals,
Yeah.
often as a continuous rate infusion, or CRI, directly into the vein. This allows for tiny, constant adjustments based on blood sugar checks.
How often are they checking blood sugar?
Very often at first, maybe every 1 to 3 hours. The goal is a steady, controlled drop in glucose, maybe 50 to 100 milli-GDL per hour. Too fast can be dangerous.
Right, avoid crashing the sugar.
Precisely. In less critical cases, or as they stabilize, regular insulin might be given as intramuscular injections every few hours initially. Once the animal is eating, stable, and the ketones are gone, they'll transition to a longer-acting insulin for ongoing management.
What happens if, despite needing insulin for the ketones, the blood sugar drops too low, say below 250? Do they stop the insulin?
That's a really important point. Generally, no, they don't stop the insulin completely, because you still need it to shut down ketone production and fix the acidosis.
So what do?
They add dextrose sugar to the IV fluids. They might make it a 2.5% or 5% dextrose solution.
Ah, so you're giving sugar and insulin at the same time.
Yes. It sounds counterintuitive, but you're providing fuel while the insulin does its other critical jobs. Once the acidosis resolves and the glucose is stable without needing dextrose, they can adjust the insulin plan.
Okay, that makes sense. What about bicarbonate? The source mentioned it's controversial for acidosis.
It is. It used to be given more routinely, but now it's generally reserved only for severe acidosis, like if the blood pH is under 7.0, or maybe if the TCO2 is extremely low.
Why the caution?
Well, rapid correction can sometimes cause paradoxical CNS acidosis, affect oxygen delivery, worsen low potassium. If the body can fix the acidosis itself once fluids and insulin are working, that's preferred. If bicarbonate is used, it's given very slowly, calculated carefully, and with close monitoring, and definitely used consciously if there are breathing problems.
Got it. Any other supplements? Phosphorus.
Yes, phosphorus often drops during DKA treatment, similar to potassium as it moves into cells. Low phosphorus can cause serious issues like red blood cell breakdown, so levels are monitored, and potassium phosphate might be used as part of the fluid plan to provide both potassium and phosphorus.
So many things to juggle. Are there times when you absolutely wouldn't give potassium?
Yes, if the animal isn't producing urine, anuria, giving potassium is dangerous because they can't excrete any excess, or if their initial potassium level is already high, hyperkalemia, you wouldn't add more.
Makes sense. Okay, this sounds like a really intensive treatment period. Assuming the animal pulls through, what's the long-term outlook?
Well, first, owner education is huge. They need to understand this was serious, and usually means their pet has diabetes that needs lifelong management, primarily with insulin.
So commitment to treatment is key.
Absolutely. And close follow-up. Initially, monitoring at home involves watching their attitude, hydration, breathing, peeing, weight. And the vet will need to do rechecks, blood sugar curves, electrolytes, maybe acid-base status frequently at first, then spacing them out as the animal stabilizes on their long-term insulin plan.
And the main way to prevent it happening again is?
Consistent, correct insulin administration as prescribed. Managing the underlying diabetes well is the best prevention.
Are there lingering risks or complications even after they recover from the DKA episode itself?
There can be. Sometimes electrolyte issues like low potassium or phosphorus can recur or take time to fully stabilize. Hypoglycemia, low blood sugar, is always a risk with insulin therapy. More severe, though less common, complications mentioned in the text include things like cerebral edema, swelling in the brain, which can happen if glucose drops too fast,
Well,
pulmonary edema, fluid in the lungs, acute kidney injury, even heart failure in susceptible animals. It highlights why treatment needs to be so careful.
definitely. So the overall prognosis, how good are the chances?
The sources consistently describe the prognosis as guarded.
Guarded, meaning uncertain.
Yeah. It means success isn't guaranteed. A lot depends on how severe the DKA was, whether there was a serious underlying trigger like pancreatitis or kidney failure, how quickly treatment was started, and how well the animal responds. Some animals do very well, but sadly, some don't make it despite the best efforts.
Okay, so wrapping this up then, DKA, definitely a major medical emergency.
Absolutely. Stemming from that insulin deficiency, triggering that whole dangerous cascade, high sugar, ketones, acidosis, dehydration.
And recognizing those signs early, the drinking, urination changes, lethargy, maybe that ketone breath is so important.
Crucial. Because prompt, intensive veterinary care is really the key. Better chances the sooner it's tackled.
And the treatment itself is complex. It's not just giving a shot of insulin. It's this constant balancing act.
It really is. Fluids, electrolytes like potassium and phosphorus, insulin therapy adjusted constantly based on monitoring, potentially dextrose, maybe bicarbonate.
Yeah.
It requires meticulous attention.
Yeah, understanding all those moving parts, the underlying mechanisms, the triggers, it really does show how interconnected everything is metabolically.
It does.
Which kind of leads to a final thought, doesn't it? When you think about all the different things that can push an animal into DKA infections, other diseases, stress, and how delicate the balance is to treat it, what does that really tell us about how fundamentally linked all our body systems are? Especially when metabolism gets seriously disrupted like this, it really makes you think about the importance of overall metabolic health, keeping that balance right in the first place.
That's a profound point. It underscores how easily things can spiral when that central metabolic control is lost.